I feel like I've completed kind of the marathon. I've closed the loop.
The new year bringing good news for some frontline workers as they begin getting their second dose of the COVID vaccine.
I am very, very grateful to just receive this vaccine in the first place.
I'll be 95% immune, and that to me is like the greatest gift I could have ever, started this year off with.
Still, there are concerns about the slow pace of coronavirus vaccinations nationwide. Some 4.5 million doses administered so far, about a quarter of the amount government officials promised.
We're also getting some new information about the vaccination rollout in Florida. For more on that, I want to bring in CNN's Rosa Flores. She's joining us from Miami right now. Rosa, some senior citizens of Florida, they've been waiting in line for hours and hours, even overnight, to get the vaccine. You pressed the governor on this earlier today. Tell us about the exchange you had.
The governor really should have expected this question, because this is week 4 of the vaccine rollout in the state of Florida. And our cameras were rolling last week as seniors were waiting overnight to get the vaccine. On top of all of that, senior citizens across this state have been asked to go to a website to get an appointment to get this vaccine. And that website keeps crashing. It was a very simple question. Why? What has gone wrong? But Governor Ron DeSantis wouldn't even let me finish asking my question. Take a listen. Governor, what has gone wrong with the rollout of the vaccine that we've seen phone lines jammed, websites crashing?
There's a lot of demand. I think at the end of the day, excuse me.
If I could finish my question.
You just said what has gone wrong, so I'm answering the question.
If I could complete the question, though.
So you're going to give a speech, or you're going to ask a question?
With all due respect, Governor,
you asked a question. I'm going to answer it.
I'm trying to finish my question.
No, you're giving a speech. You asked a question.
I am trying to ask you the.
You're going to ask how many questions? You get 3? They only got 1 question. Why do you get 3?
With all due respect, Governor, I'm just asking if I could finish my question.
You didn't. You finished the question.
I did not. My full question is, what went wrong with the rollout of the vaccine when we've seen phone lines jammed, websites crashing?
So you're repeating your question.
To complete it for you, Governor, we've seen websites crash and also senior citizens waiting overnight for the vaccine.
Where was that at?
We've seen it in Duval, Broward, Orange, and Lee County.
And why was, in Lee, why did that happen? Did you investigate why?
That's my question to you, Governor. You're the governor of the state. I'm not the governor of the state.
Okay, but you didn't investigate why that happened, in Lee County. Why was there a big line? Did you investigate why?
Could you tell us why?
Because we distributed vaccine to hospitals, and the hospital said, first come, first serve. If you show up, we'll do it. So they didn't use a registration system. There wasn't anything that was done, and there's a lot of demand for it. So people are going to want to go ahead and get it.
So are you saying there was no plan then from the state to make sure that senior citizens didn't wait outside overnight?
So the state is not dictating to hospitals we're not dictating to Carlos Magoya how he runs his operations here. That would be a total disaster. These guys are much more competent to be able to deliver healthcare services than a state government could ever be.
Now, Florida Governor Ron DeSantis has maintained that his priority is to vaccinate Florida seniors here in this state. Now, my follow-up question to the governor was, why are assisted living facilities still waiting for vaccines? He didn't answer my question because he walked off right after that exchange.
You did an excellent job, Rosa. We're very proud of you. Good exchange indeed. He should be patient. He should answer these questions. These are life and death issues that especially people over 65 years old in Florida are facing right now. Thanks for that, for doing what you did. I want to bring in our chief medical correspondent, Dr. Sanjay Gupta, right now. He's the author of a brand new book just coming out tomorrow. You got to get it. It's entitled Keep Sharp, Build a Better Brain at Any Age. I can't wait, Sanjay, to read your new book. It's going to be amazing. But let me get your reaction to what we just heard, that exchange that Rosa had with the Florida governor, Ron DeSantis. It's heartbreaking to see these elderly people just waiting in line, sitting there overnight because they hope they can get a vaccine.
Well, Wolf, I can tell you it strikes very close to home. First of all, what Rosa was asking about is happening. I mean, it's not an exaggeration. And I know this because my parents were two of those senior citizens who waited all night in Lee County to get their vaccines. The way it worked for them was that they basically wanted to get the vaccine. They started searching online to try and find where the vaccine might be available. They were told that the local library was going to have a certain number of doses. So they got there at 1:30 in the morning. It was like, camping out for a concert, except that my parents are in their late 70s. It's outside. They're trying to maintain distance. This is, I think that's the frustration. And I think that's the frustration you're hearing from a lot of people. Fantastic that the vaccine is out there, but this is what it's sort of come down to as far as distribution goes in some places, not everywhere, but in some places. And it's as much preparation as there should have been. This should have been a more coordinated rollout in many of these places.
I don't understand, Sanjay, why FEMA, the Federal Emergency Management Agency, or the National Guard, the military, has not been activated. People are dying. They activate the military and FEMA if there's a hurricane or a tornado. But why aren't they activated right now to get these shots into the arms, especially of the elderly?
I really don't know the answer to this, Wolf, but it's been a note that we've heard many times throughout this pandemic. We're going to do this at the federal level, and then the states sort of have at it. The states that have asked for, in the billions of dollars to create an infrastructure of public health that could handle something like this receive $480 million. So they've been woefully underfunded, and it's been very hard for them to then take a brand new vaccine that requires the kind of cold storage that everyone has heard about by now and be able to distribute it. So it's become a situation where people are sort of trying to fend for themselves. Like, again, my parents just sort of found this vaccine by on their own. There was no unified strategy to try and distribute it to them.
Yeah, this is an awful situation. Sanjay, we'll continue this conversation. Thank you.
Would it be better if the federal government just stepped in and took over the effort to get millions of Americans vaccinated?
Well, rather than stepping in and taking over, I think it would be maybe better to give more resources and to work with them, in tandem with them. In other words, it's not saying we're taking over, we're going to do your job, but saying we're going to really help you to do your job, particularly by giving you many more resources.
In some provinces in Canada, as you know, after the first dose, they're letting people walk around, and apparently, reportedly, that provides perhaps up to 40% protection against infection, unlike what we're doing, reserving both doses for millions of Americans. Should we change our approach, perhaps?
Well, I mean, that's under consideration. I still think if done properly, you can do a single dose, reserve doses for the second dose, and still get the job done. But there's a lot of discussion about whether or not you want to spread out the initial vaccination by getting more people vaccinated on the first round. And you could debate either way on that. One of the problems of doing that is if you don't then get the second dose in time, you're going to have a lag period. And we know from the clinical trial that the optimal time is to give it on one day, and then for Moderna 28 days later, and for Pfizer 21 days later. That's what the data tells us is the best way to do it. So if you want to stick with the data, that's the way you should do it. But you can make an argument, and some people are, about stretching out the doses by giving a single dose across the board and hoping you're going to get the second dose in time to give to individuals.